Hello, Professor Zambrana. I'm Mauricio, and I'm here to present a video about the suctioning of pediatrics patients. So, this is my baby, and this is gonna be my presentation. So, before we start doing anything, of course, we have to make sure we understand suctioning because suctioning is not something like the doctor put an order in the computer. Suctioning is as a needed. So the nurse can call and they say my patient needs suctioning, suction because he can't breathe. So it's to improve to breathe better. So suction is used to remove the secretions from the mouth uh, from the mouth from the mouth and it's indicator when the infant like a little baby is unable to clear it up the secretions from he or she uh, own. So so that's why suctioning is required when the patient cannot remove those mucus. And usually it happens when the patient has pneumonia or common cold or bronchitis or some sort of disease, and the patient is not able to clear up the airways. So before anything, we have to perform the hand hygiene. You have to wash the hands, and after wash the hands, we have the package. All right, we can open it up the pack, but you have to understand everything is sterile. So we open it up the package, all right, and we keep in bed, but we not touch anything. And then we set up the suctioning, the canister, and we turn it on the pressure, and we have to make sure it doesn't go above 100 millimeters of mercury. And we turn it on the pressure, and we make sure it's working, just tipping the top of the tube. And then uh, we put the sterile gloves with one hand, and then we have sterile water or saline. We make sure we have sterile water or saline, and we measure it. We open it up, the package, and we grab the suction catheter, and we make sure we measure it from the tip of the nose to the ear, um, um, to the ear lobe. So, but when we measure, we have to make sure not touch the skin, just to prevent any infection. So when you measure it, usually it's between 5 to 6 French for a baby who is preterm, like um, 37 weeks. And for dumb babies cannot, do anything. It's about 8 French. So we measure it, and then we connect to the suction tube, and it's already on 100. And then this is the measure between, let's say 5 to 8. So we make sure when you do the suctioning, we not stay too long. It's between like 5 to 10 seconds, and we cannot pass the measurement. So we go to the mouth, and when we do that, we make sure it's no pressure at all. And when the catheter, the tube catheter, it's inside, you start tipping, the airways over here. So this way, all the mucus can come out. And sometimes it's a little bit thick, So what we do is we grab the saline or the sterile water, and then we put inside to make sure, to put it, I'm sorry, to put in the tube to make sure we can clear up. And after we suction the mouth, we can go to the nose, you know, to make sure everything's clear. After we finished, we turn it off, and we dispose everything where it's supposed to be, the garbage. And we remove all the equipments, we put in the package, and we toss. And when we finish the therapy, the suctioning, we make sure we turn the baby and see if the baby can breathe better. All right. Anything else? So this is my presentation. Hope you like it. Thank you.